So today's our first and our initial podcast, and we would love to highlight Tara. So Tara works in the office and does amazing things. But why don't you tell us a little bit about your journey and how you got here, and then we'll expand upon that.
Okay. Excuse me. So I was thinking about this actually on the way over here, um, and thinking about how sometimes in life, when you're in the middle of something, I equated it with like crossing a creek, but as you're crossing it, it feels more like a raging river, and everything's unsteady, and you're insecure about taking the next step. And then when you're on the other side of it, you look back and you're like, oh, it was just a series of stones that I had to cross to get here. But my journey to this particular place probably began long before I realized it. I was a hospital nurse and I had worked at Lancaster General for 7 years. And
And when you were there, what department were you? Were you in any, like, what kind of nurse? Like,
so I was on a med surge floor, but the floor's particular specialty was GIGU
oh, okay.
and urology.
And GIGU, for those people, what does GIGU mean?
Basically, I always tell people it's from anything that you ingest to divesting.
Okay. So GI stands for,
Gastrointestinal,
and GU stands
genital urinary.
for. There you go.
So bowel surgeries, any kind of issues, kidney stones, and then we also had the general med surge population, which was pretty much anything that I always joke.
Appendicitis.
Yeah,
too.
they would punch somebody in the stomach and they'd be like, okay, GI, GU. And then they show up and their true issue is that they have pneumonia, but we were kind of the catch-all.
Okay.
They would come to us and then we would decide if they were appropriate for our floor or if we needed to send them somewhere else. So I did that 7 years.
And you saw some unique things there.
I did.
So it's kind of amazing, and we'll probably get to some examples even in this office of things that you just don't believe are so, but they are. And I'm sure you saw that firsthand at GIGU.
It's very interesting what people find to do with their spare time.
So things that you say, well, that's got to be a Photoshop, or that's got to be not real.
Nope, it's real.
It's real. So
people make those decisions.
Yeah, there are outliers of norm.
Yes, yes.
And in our office, we kind of try to focus on the healthcare that's not norm. So it's kind of nice that might have been even a reality prep. Like, I never thought this was possible, but it is.
All things are possible. At least in the initiation of them.
I think that'll fit in there.
Yeah. It's the follow through sometimes where you need a little assistance. Yeah. And so originally, the whole reason that I actually became a registered nurse was my end goal was to be a midwife. And so in Pennsylvania, you become a nurse first, and then you become a nurse midwife. And I got stuck on this med surge floor, which was a great opportunity to learn many things about the human condition and see many things as far as within the medical community and how certain situations were handled. And it was great. Anytime I'm interacting with people, I love it because I love the human condition and I love engaging with people. But it wasn't really satisfying the way that I envisioned myself as a care provider. But I was stuck in like the comfort of going to a job, knowing what I had to do, being paid well to do it, and health insurance and all of those things that you kind of allow to hold you in place even when you're not feeling fulfilled. And then I was in a car accident. After I actually had a series of back surgeries that kind of fall hand in hand with floor nursing, and
So what happened there? If I can, and you can, this isn't. You can say, let's skip that topic. But
So no. So on my, I think it was my 41st birthday, I woke up basically unable to walk. I had this shooting pain down my right leg. Every time I stood up, I would say a series of bad words.
Like rats and darn?
Yeah.
And ouch? Yeah.
Like fudgesicle.
Yes.
And I ended up, I had ruptured a disc. And so it was so significant and immediate impingement that I actually had foot drop.
Oh, wow. That's impressive.
Yeah, thank you. I go for the gold.
Yeah.
I'm an achiever. And so I had surgery for a revision after failed physical therapy. And then it re-ruptured. And then I had another revision. And all this time I was off of work and just trying to negotiate life with this extreme pain and a right foot that I would have to be like, come with me now foot. So I was tripping a lot. It was
Not
actually,
it was
it was my first real health care or health crisis that I experienced as a relatively healthy person, aside from birth, which is a very normal process, and you know how I feel about that. It was the first time that my body sort of showed up and failed me in a way that I had not expected, and so in the course of healing from that, and after my second failed surgery, I ended up with a spinal fusion of my L4, L5, which is not really usual for somebody my age. But I had also snowboarded, skateboarded, fell on my butt a lot.
So your fusion's L4-5.
Yeah.
You know, that's interesting because I have found in my experience that an L4-5 rupture is 100% correlated to a short leg, one leg shorter than the other.
So after coming here, you told me that.
Oh, did I?
Yeah. You
my memory's not as good as it once was, so they tell me.
Yeah. So you adjusted me and were like, oh, L4, L5, you're one leg shorter. And that is actually true. So,
good. And I was consistent, right? If
had I known that my whole life could be changed by
by
orthotics,
yes.
yeah, I would have done it. And it's really, we'll get back to that because it's an interesting part of this journey. So after my fusion, I had sat a lot more than I had ever sat in my whole life, and I thought about things, and one of the things that I decided was, after I saw how drastically a body could fail you in, what it brought to my plate as far as having to adjust my whole sense of who I am and how I interact with the world, I was set on not going back to the hospital as a floor nurse. Not only because it wasn't fulfilling me on a soul level, but also because it was just physically demanding work. You're constantly lifting, moving, pushing, pulling people. And unfortunately, the patient population is usually, I'm not seeing healthy, fit people.
Right. They're on med surge for a reason.
Yeah. So despite that, I had been released to go back to work, and my self-talk was, I'm going to just do this till I find something else. Mm-hmm. Although there was a part of me that was like, you're just going to fall back into that comfort zone, and it's easier to go back to what you know. Sure. And so I literally had gotten the go-ahead to go back to work. I got in my car to drive down the road to pick up something at a store 5 minutes from my house, and on December 20th, 3 years ago, this year, somebody hit me head on after falling asleep behind the wheel. They were coming from they were actually in the ER, and they were coming home from being in the ER all night at the Hershey Med Center, and fell asleep and hit me, and I ended up having 8 broken bones, and I was in the hospital for 3 weeks, 1 week in Hershey and 2 weeks in the rehab. And then I went home with nursing care, 24/7 nursing care. I had my left arm to negotiate my whole world with because everything else was in a cast.
Wow.
Yeah. And so I had even more time.
Sounds like the universe doesn't want you to go back to med surg,
Well,
right? So,
that's one of the many lessons is that, when the whispering starts from the universe, I'm like, okay, I'll listen this time. I don't need that
you don't
abrupt
need a hit over the
stop.
head with a frying pan. Yeah.
And so talking about renegotiating my contracts with myself and my obligation to fulfill the part of me that my soul, and as that occurs, how it affects everybody around me. And so after a year of not working and spending most of the time in recovery
And not being able to work.
and not being able to work,
It wasn't a choice. You were
no,
not
there
able
was
to
no
work.
choice.
Yeah, right.
And having a lot of issues surrounding being in a car because I got in a car and did everything right, and despite that, somebody hit me.
Independent of your actions.
Independent of my action. So it was like control had always been a part of my life, and trying to hold on to everything and make it just so, which is one of the reasons that it was hard for me to let go of my job and the status that brought me.
And the sense of security, true or false, it was a sense of security. I mean, you go to work, you provide for your family. This is the security. What else am I going to do if I don't do that?
Yeah.
Real quick aside, I don't know if you know, I had a bicycle accident.
Yes.
Yeah, and so I was doing functional medicine probably 50 or 60% of the time, and physical medicine, chiropractic care, the other 50%. And I did feel that I was supposed to be doing more functional medicine, but I wasn't sure how to make the transition because I had been doing, physical medicine too. And I flipped over my bike and I couldn't work for 2 years, and I couldn't hold a pen for a year and a half, so I couldn't even write notes because I broke both my wrists and had 7 surgeries. And so I think I said the same thing. I said, God, you could have just whispered in my ear. And he said, I was whispering in your ear. I needed to hit you in the head with a frying pan. You had to flip off your bicycle and break everything. So it's I digress. Go ahead.
Yeah, so no, it's an understanding of it's your identity is wrapped up into this thing that that you are able to provide for yourself, for other people, the service, and then it's taken away, and then you're like, who am I?
Right.
In this moment where now I can no longer do anything but really just be here. So despite that time and reflection,
which you never would have called upon yourself to have, but was very telling, very educational, it changed the trajectory of who you are.
The course of my life. It changed how I interacted with my family. It changed. I was a single mom during this time also. And so part of what we, and when I say we, I'm speaking to other women I know in my situation, we identify with this ability to persevere despite our worlds crumbling around us. We will get up, be strong, provide for our children, and never ask for anything because
it's never about you, it's always about others.
Yes. And our society has taught need as being a weakness, when really asking for help is very strong, and that's one of the things that I learned.
One of the quotes I use is, there are times you just need to make yourself the most important person in the room, and the most important person in the world. And it's not because you're being selfish. If you make yourself the most important person in your life, then you will then be able to recover from whatever it is and give out of abundance, rather than there's only so much of me to give. If you're the most important person, you're going to take care of yourself. And you're not the most important person because you're an arrogant jerk. You're the most important person so that you can fill your cup to give it to your children and give it to your patients and give it to your world. And so often, need is I need to be healthy so that I can live out my purpose.
Yes.
And my purpose may be, being a jerk, but if my purpose is to serve and help others, I can't do that unless I'm whole.
That is one of the hardest things for people who provide care to embrace within their own truth. Yeah. And so I learned how to ask for help. And I tell people that come here all the time, we see people who are church leaders, we see people who are community leaders, and I tell them, what an honor it is to allow somebody else to care for you, because you're always giving to other people. You're always providing this connection and service, and to allow somebody to take care of you in your time of need, it's an honor.
Such a profound lesson. And what a terrible way to get there, but what a great gift. To be able to reflect and say, your story, and realizing that we all need help sometimes, and feeding ourselves, to be able to share that with a church leader, a pastor, or somebody, a leader in the community, who's probably in the mindset, I have to fix things or give things, and for you to be able to relate that, I think, is a large part of the health journey for these patients.
Yes, it is, because we see a lot of people who are exhausted by their own journey, and getting here has been, there's so many stories that I feel connected to, because I see myself in their stories and in their journey, and it is a gift to be able to say, I was there, I was afraid to ask for help, and then I saw that not only is it the strongest thing that you can do, but then you also allow other people to provide for you, which gives them a gift, which then enables them to carry that out into their work.
And just a little diatribe, because I'm kind of famous for going on these rabbit hole journeys and wormholes, and isn't that a piece of healthcare that's missing? So you're coming in to get better, but there's no human connection. And one of the things I love you like an angel, but the fact that you can make such a human connection with people, is that alone changes their health trajectory. And I just think and I'm not here to condescend, but institutional medicine, where their jobs are so overwhelming. So it's not a judgment. You do the best you can in a war zone, so to speak.
Right.
So, but there's that lack of humanism and that human compassion, which I think is so important. Maybe not if you need stitches because you cut your wrist, but in a chronic, I don't feel gooditis, which is kind of my term. What do we take? I don't like labeling things, but things aren't going the way they're supposed to, and it's chronic. I think compassion is an essential medicine. It's an essential piece.
It's so important. And so as I talk to our patients here, one of the things that comes up, because with a chronic illness, you're not always carrying the external signs that you are unwell. And so what I relate to...
No scar across your face.
Right. When I had 8 broken bones, everybody knew it, because I'm walking around with a walker and I have cast, and so I'm receiving this sympathy, because people see and they engage, because I'm unable to do things and they're aware of that. And people come here, and there's a lot of times there's no longer any external symptoms. There's also this lack of belief. You've been tired, just go to sleep, or pull yourself up by your bootstraps, or you know.
An analogy is, if you're in a walker with a cast, nobody would say to you, get rid of your walker and walk faster.
Right.
But if you're suffering from anything from depression or fatigue, or even chronic debilitating headaches, or people would say, oh, you're tired? Drink a cup of coffee.
Right.
Get to bed sooner.
Yeah.
You're depressed? Be happy. Well,
Yeah.
if it was that easy,
Yes.
they wouldn't be in our office.
Nobody
right?
chooses this.
Today I'm going to get up and say I feel like crap and I have no energy today and feel blue, and
Right.
the world's not a place to work. So it's such a huge, again, perspective piece. And so you make a great connection with patients, because you value that. I don't want to call it emotional piece. I just want to call it human. It's the human piece.
It is, the human condition.
Yeah.
And I know, after my casts were removed and after I was negotiating my world relatively normally, as normal as I am able to.
You're normal?
I think specifically about getting into a car and trying to explain to the people who were unlucky enough to be driving with me that I had actually no control over my physical reaction to driving, and the fact that if you've ever had any kind of anxiety producing or traumatic event, you know that any sort of extra stimulus, any sort of extra anxiety, you're starting into that loop. And so we would go driving, which before was a completely normal act, and now there's a possibility that if I saw somebody swerve over, I'm going to be screaming in the back seat, and people are saying you can't show your children that you're so out of control. You have to like get it together. And I think to myself, if I could control this,
Right.
but it very quickly becomes something that's not
Controllable.
part of my thought process.
Right.
It's a physical reaction.
So I equate that to somebody saying to a patient who has a seizure disorder, just don't have a seizure.
Right.
Like, just don't freak out in the back seat. If it was a controlled response, if it was an executive decision to say, you know what, I'm going to freak out in front of my kids right now and possibly induce some trauma to them, I probably wouldn't make that decision. And so if you said to somebody who's having a seizure, just don't have it.
Yeah.
Just don't have that seizure. I mean, why would you have a seizure in the middle of the shopping mall or in an airport? Like, don't do that.
Yeah.
It doesn't make any sense. But it's an uncontrollable, both of those, while one may be an emotional, I don't really think it is. I think both of those are rudimentary, brain-based issues,
Right.
and they should be addressed and at least respected with the same level.
Yeah. But it taught me something as I progressed through my own visual need. Here I am. You see that I am unable or physically incapable of doing something to hear. Now it's mostly emotional, which creates a physical reaction. But I see that pulling away of understanding by people that I love and that care for me. And we experience that a lot here with our patients.
So you feel the guilt and the shame of the reaction you're having, and in reality, it's a lack of compassion and understanding from the other side. Yeah. And so isn't that somewhat a microcosm of healthcare and chronic illness?
That is so true. And why, despite that accident and me once again sitting with myself and making these promises that I was not going to return to something, like not only now did I see I could be physically impaired instantly, but now I also saw that life could end despite the fact that it's a sunny day
right,
and I have my seatbelt on and I'm driving the speed limit. And despite all of that, I still had to go back to what was comfortable, and I accepted a position when I was able to return to work at Hershey Med.
Okay.
On a med surge floor.
Sure.
This might sound familiar. Where, once again, all of those things that I wanted to bring to my practice as a care provider wasn't necessarily possible. And now I believe that you can, each moment you have with a person, you have an opportunity to engage with them, to give them something that they might not otherwise have in this interaction, whether it's a smile or a gesture or even just looking somebody in the eyes these days up from your phone and making that connection.
It's amazing. We used to have a center for special needs children, and Heather, my wife, said, you only have a limited amount of time to make a dramatic difference in this child's life. And we've kind of parlayed that over to our office here. Like your interaction for you all day, if it becomes mundane in an 8-hour day, you're saying, I did my 8 hours, I punched the clock. But for the patient who is with you for anywhere from a half an hour to 5-6 hours for some of these really in-depth IVs you're doing, it's their time. It's the only time they have to heal, and they're probably not going to get that level of caring, compassion, healthcare outside these walls.
That is so true, and it's actually my experience last night. I'm here, and we our patient population respond just like all of us because we're organic and dynamic beings. The way that we receive treatment is different from person to person, and it's a wonderful experience to be able to adjust and accommodate somebody and allow them to finish a treatment rather than saying 5 o'clock,
Time's
my
up.
shift's over,
Yeah.
doors are closing, and so I'm here last night till 8:30.
When you're supposed to leave at 5.
When things were
Yeah.
scheduled
Perfect.
differently, but then of course the
Life
human
happens.
condition
Yeah.
responds in the way it does, and so
An amazing attribute to you and flexibility, which isn't always great because we don't want to impinge upon you, but to be able to care for somebody in their time frame, in their world, rather than
Yes.
forcing them in our world saying, you'll do it in our box. I know personally, and I'm interrupting you quite a bit, but rarely a day goes by that I'm exactly on schedule with every patient.
Right.
Because if I schedule an hour or a half an hour or an hour and a half, I have no idea what that human condition brings me that day. So, and I think though, and you hopefully can echo this, when I run late, rarely does a patient get upset because they know they've been on the other side. And I've heard this cliche, oh, I'm running late, but I'll give you the same amount of time as I give everybody. But if I don't really even have to say that, and I know you don't either.
Yeah.
So now some people are inconvenienced because they plan on coming in at 1 for their IV and they don't get in or see me. But once you've experienced such a unique interaction with the healthcare provider to say, I'm here on your schedule. Like
Yes.
I'm here, and it's not I don't just, I got a golf match or I got a whatever the heck it is. I don't golf, but but to say that, and I'm checking out at a certain time.
Or well, so it's so true, and really, of course, we talk about boundaries all the time and maintaining our own boundaries and making sure that we don't overextend ourselves, and that's part of, like you touched upon, being a good care provider is taking care of yourself so that you're able to care for others. And
You haven't figured that piece out yet. So.
yes. So the thing that was touching as I'm trying to create a comfortable situation for this patient, and I'm pulling in different modalities. So I had Suzanne come and give a foot rub, and
Which, for those that don't know, Suzanne Jones, our massage therapist, is. I mean, I called you an angel, and she might be like the lead angel, right? So she's
otherworldly.
Yeah,
and
she's
amazing.
a presence that is. And I don't. I know it sounds like our first podcast, but she's truly a gift from God.
Oh, she is amazing.
Her voice, her touch. She enters a room, and it's like everybody took lorazepam. Like everybody just calms down, and then when she touches you, you just, coming from a scientific background, Suzanne Jones doesn't make sense.
Yeah.
But because you cannot explain her with a label. I was listening to something, and describing her in 1,000 ways almost is an injustice. You almost have to experience it. And I would equate, we were talking last night, but telling you what wet is will never give you the experience of what it feels like to be wet. So I could say, well, it's this feeling, you kind of this, and you describe wet as any way you want to and say it's wet. Suzanne has, like, it's just, you can't describe it. To put a label on is almost a disrespectful thing. It's an experience. Anyway.
We have this unique opportunity to pull in different modalities, and most of the time, our other providers are very gracious, especially if you're saying somebody's really struggling, this is uncomfortable for them, how can we help? And so she came in and she gave a foot rub, and we had the patient on the pulse mat, all just trying to divert a little attention from the discomfort and make things feel easier. And so at 8:30, about 3 hours,
3.5 hours after her punch in, punch out time frame, right?
We're here, and finally the treatment's over, And she says to me, the patient said, I appreciate the fact that your face looks no different now than it did when we started. You don't look tired. You don't look hurried. You don't look like you're concerned about the fact that we're here at 8:30. And I said, just really each moment, touching upon what you said, everybody deserves the equal respect of their time, the equal treatment of who they are as a person, regardless of what I've been doing up until the point before I walk into this room. I'm here with you. I'm not thinking about where I have to be, when I should have been there, because that's not what this is about. And people sometimes ask me about health insurance, and we have a different model here. And I said, the minute that we have to work around somebody else's blueprint of what care should look like, we're no longer able to do what we do, which is this more organic approach to helping you return to wellness by being responsive, by giving you time, by being able to ask somebody else to step into the office in this moment because I see that you're uncomfortable and what I'm doing, my interventions aren't working.
Wow.
And that would all go away.
What a blessing. And probably the converse to that is what a detriment to somebody who has already felt a burden to their family. They've been a burden to their family, society. They can't work their job, whatever they can do. And now they're a burden because you were supposed to get out of here at 5. And so the level of just beaten downness, there's probably a word for that I don't know. There's just a level of, I'm just such a burden to everybody. The ability to say to them, no, you're important enough. I try to use this with my patients too, and I know you do. You're so important that it's okay you're here at 8:30. Now, we're not going to do it every night because I do have a life to do. So, but
I do not have a life.
Yeah. But I mean, not only is the benefit appreciated by me that you looked her and said, it's okay, you're the most important person in the room. But the converse, which is probably what she's used to in the society we live in today, is you're such a pain in the butt. Why do you have to? And I know, I mean, I struggle with this with my own mother sometimes. So I'm like, can't you walk a little faster? But if but then I'm reminded, she wouldn't do it if she needs the care and love and respect too. So, that's huge. That's just a huge piece. So anyway, so you're going on your journey, and I'm digressing you 1,000 times.
So actually, I stepped back into a role as a floor nurse at a medical center, and very quickly realized that, yes, once again, I had made the wrong decision for myself as a care provider and what I envisioned my practice to look like, and falling back into the time constraints, the lack of connection. I use the term, and I don't want to be disrespectful, but I use the term factory medicine, right. Because that's my experience.
Institutional medicine.
We're down, it's an assembly line. Everybody comes in, looks at one part, and then we have an internist that tries to pull it all together. But
doesn't get the respect from I'm interrupting you, but the internist who's trying to pull it all together is perceived as below the specialist, the ologist of the world. So the ologists, there might be 5 ologists, neurologist, endocrinologist, gastroenterologist, and then the internist has to put it all together, but the ologists are kind of above them, but really the internist is the one that should be on top, dictating to the ologist.
I feel the same way about nurses.
Yes. Well, it's true because those who get their hands dirty and have to put it all together and deal with the human being. So again, if I see a number on a piece of paper, I say, you're not a number on a piece of paper. You're not a blood test. You're a human being who's reflected by that. And that's just a piece of you. But to get to know you as a person, which I know you excel at with your patients, you get to know about them. And,
yes.
And so, like in the hospital, you're like, well, I'm looking at your lung condition. Well, yeah, I have a lung condition, but I don't sleep well, and my husband abuses me, and I live in a moldy house, and so you're going to treat my lung infection, when reality is that's not what's
systemic.
Going on.
Yeah, and that's why internists really are, they deserve so much more, because they're not just looking at the one piece, and they have to pull it all together, make sense, and then approach the patient with this neat little tied up, this is our plan of treatment, this is how we're going to pull all these other parts in.
Good friend of mine, Datis Karazian, who's written several books and is a pretty big fish in this space. Brilliant man. He said the goal isn't to be the best specialist, but the best generalist. So to be the best generalist is really what you want to do, so that you can understand and conquer might be the wrong word, but understand all those pieces, because the ologist, the neurologist and the cardiologist may not be talking to each other, but to be the best generalist. And so often we strive to achieve the goal to be the specialist so we can be above everybody, but that makes you look good on paper and get your name in blinkety blink lights, but at the end of the day the patient wants the best generalist.
Yes, yeah, which is
or the best nurse, right?
Well,
yeah. Right, the best person to care for me.
I'm partial to nurses, because we are also expected to go across all of those spectrums, not only to be able to understand and assimilate the information, but then to efficiently articulate that back to each specialist.
Right.
And then meet with the generalist or the internist, and also work towards formulating that picture so that we can, in a sense, provide holistic care, but in the hospital.
Very underappreciated service.
Yeah. So.
And you went back into it again.
I love hospital food.
I love lack of nutrition and nutrient deficient
I love
foods.
the fact that we address everything else except nutrition.
Yeah.
And so, yes, I went back into it and became all the things that I was looking to get away from: the physical fatigue, the mental strife, the hours that aren't conducive. I can do a 12-hour day here because it's a different, energetically, it requires different things from me than a 12-hour day in the hospital.
It's interesting you said that, because you said the hours, and yet we just spent some time about how it didn't bother you or strain you or tax you to put in a long day for a patient, because I think you have a sense of purpose and appreciation.
Yes.
And so a long hour here, and I'm the worst person because I work 12 hours a day, and it's not healthy, but when you do it out of a sense of abundance and giving, and
right.
as opposed to you're not appreciated, you're underappreciated. And so anyway, that just struck me, because you're saying I got to get away from those hours, but I'll work over there.
Right. Over here.
With a sense of purpose.
It is very different. And so 3 months into it, I actually ended up getting punched in my sternum by a patient, which was one of my broken bones.
Oh.
And I felt like here's probably not quite a scream, but more than a whisper from that good old universe, reminding me, especially it being so close to my heart, that this is not what I want to do. And so I finished my shift and I walked out of the hospital, and I knew I wasn't coming back. And so I put it out there on the facade book, as I call it, and found my way to this opportunity, which, first of all, I was like, how does this place exist so close to where I am, and I've never heard of it?
We've pretty much, most of our providers, nurses, nurse practitioners, one of our nurse practitioners, Cassandra, who I loved, when she saw the ad we put out for her, she thought it was a fake ad. She's like, there's no way compassionate healthcare, with getting to the root cause, taking the time that it takes to figure out what's wrong with the patient, in an environment where they don't beat you down and just squeeze every drop of juice out of you. She answered it, almost didn't answer it because she almost thought it was fake.
Yeah. Well,
yeah.
And then to come here and to see all of these services in one spot, and it's 27 miles from my house, and here I probably always thought that this is something that exists maybe in a big city or maybe on the West Coast, where care is approached a little bit differently, but not here in Pennsylvania.
I know. I lecture, as you know, all over the country and a couple of times outside, but all over the country. And every time I lecture, like, what are you doing in Mechanicsburg, Pennsylvania?
Yeah.
You belong in like L.A. or San Diego or San Francisco or Miami or New York every time.
Yeah, yeah.
And they all say, you can make so much more money here, there. And I kind of said, there's a lot of people in need everywhere, and 50% of our patients come from greater than 2 hours away. So they're coming from New York, and they're coming from D.C. and California. And it belongs here just as much as it belongs anywhere. And it's not about blinkety blink, big lights. It's about taking care of people. So I'm actually try not to be prideful, but the fact that we're not in New York City, we're in a town called Mechanicsburg,
Yeah.
blue collarville,
Yeah.
right? So that just says, hey, and I want to be able to take care of my neighbor, not just the people who have private jets.
And also, amongst our patients, they speak to the fact that you've primarily grown this center just like word of mouth.
Yeah.
Because one of the first things that I realized, I was like, there's no, like, how would I have known about this? Except for word of somebody's mouth. And then they pass on, the care that they've received, and they tell other people about it. And now you have 2 centers that are right. opened up and meeting the needs of this patient population.
Yeah, we're really bad at, and I've always been really bad at marketing. And you've been to one of my lectures, and they say, what do you do? What's your marketing plan? And I say, I usually walk up to somebody in the front of the lecture room, usually a man, so I don't get in trouble, put my hand on their shoulder and say, I care about you. Yeah. I don't know how, just do what you're supposed to do. Care about people, and don't worry about this, marketing this, marketing that. And we need to do that. I mean, clearly we need to do that, but it starts with your purpose and why you do what you do. And if your purpose is to make a bunch of money, I mean, there's nothing wrong with being successful, but your success should be built on, in this business, taking care of people. And so you're right. We're word of mouth. And who builds an office this big, one of the biggest in the country? Coca-Cola didn't become Coca-Cola just by word of mouth, or Pepsi. They spend $1 gajillion on ads, but.
Well, you have many people that go out every day after leaving here and are your ad.
Right, and that's really, it's not the most efficient or effective way, but it's worked, so it's hard to argue with it, right?
Yes, yeah. And so I came here, and then it turned out that I actually knew Heather. We went to high school together.
Yeah, how about that, right? So my wife, who runs the practice, went to high school with you.
And her mom was my school nurse.
And her mom was your school nurse, right?
Which I spent a lot because I was a hypochondriac.
Well, and her mother kind of unaware of this, but she wasn't even a nurse. She was a nurse's aide. But people would go to her, and I don't know if you had this experience with my mother-in-law, but people would go to her for career counseling and family stress at home, because she was the person you'd say, listen, you're a human being, I'm here for you.
Yes.
Just a unique quality to say, you're not coming here because you got a sore throat. You might be coming here because your parents got in a fight this morning, or you're coming here because she said she did as much, and I don't know if this is true, as the guidance counselors, because people would come and they'd say, what are you doing with your life? And she'd say, well, let's talk about it.
No, that was me. I spent a lot of time in the nurse's office. That might have been my first, my mom was a nurse, and my stepfather is a physician, so I grew up in that atmosphere.
Right.
If anybody knows, when you have that dynamic in your household, you hear a lot of things. And then I had the natural desire to learn for myself, and so I would go into his office, and the first book that I read was a pediatric skin disease book with pictures.
Sounds great.
Yeah, so then I started thinking I have all these weird diseases.
I must have that. Look at that.
And then as I was laying there worrying at night, I wouldn't get enough sleep. And so when I went to school the next day, I'd go to the nurse.
And Janet would talk you
and
off the
Janet
ledge.
would talk me off the ledge. And then eventually my mom was like, you should put all that neurosis to good use and go to nursing school, which I did. And so, yeah, so when I came here and I saw Heather and I was like, oh, well, this is just, supposed to be.
Right.
And then she, of course, after meeting with her a couple times and being here, it felt so natural, and it felt like the opportunity to step into providing care like I truly had always envisioned myself, being able to spend time with people. And what I love about our patient population is that unfortunately most of them have spent a lot of time in conventional medicine and have been. I hear so often people saying, well, they tell me I'm crazy, the symptoms are in my head. And so they've really had to educate and advocate for their own care. And so
While they're sick.
While they're sick. And so these are really smart people who I tell our patients all the time when they're in the IV room that a lot of times they're bringing us stuff too, right. Where they're like, I've read about this, can we try this out? And you're very good at being proactive about that and looking into it and seeing if it's relevant in our goals of care. And they're also, just in all of their struggle, they're so beautifully vulnerable and open to receiving care. And a lot of times you said about like not even believing, like I can come here, I can spend this time with you, I can feel this connection. You remember me, you remember my family, you remember what we talked about the last time, although not always because, having Lyme myself, the joke in the IV room is who even knows what we just said? We all have brain fog. But they feel...
And I want to take this opportunity because it's very easy to change perspective, and I know you're not doing this, but it's easy to be perceived that we're coming down on institutional medicine. But neither one of us are. We are providing an outlet for those that institutional medicine is failing. Yes. And it's not to say that institutional medicine fails everybody, right? It's right. To say that there needs to be a greater understanding, in my opinion, that institutional medicine doesn't capture all conditions.
That is true. And I think I feel strongly that the beautiful thing about this practice is that there is no ego involved in asking or sending somebody if it goes beyond our ability. There isn't we're just going to pass it off as it's in your head, or it's you are open to saying I cannot see my way through this. We need to bring in somebody else.
Well, an interesting perspective. I'll bring in Delaney, our marketing director, for just a second. So when you came here, I don't know that you were aware of all what we did here and that these type of services were even available out there.
No, not at all. I actually had to look a lot of them up. I didn't even know what they were, let alone, know that they were available, know that they were here in the practice that I was about to work in. So it's definitely, it's amazing all the things that you guys are able to do.
And then you hear patient stories and forget about, this or that, or that's not double-blinded, or they don't do that in standard medicine. When you hear a patient's outcome, I have a brilliant friend, Sam Yannick. He works in North Carolina, and he's on staff there. And he said, and he probably has read more research than most of the East Coast combined. And he says nothing is as powerful as a patient's outcome, and we need to look at the human. And so one of the comments I know you made to me was, I can't believe seeing this.
Yeah, in my first week even, patients would come in and Dr. Turnpaugh is actually my uncle, for anybody who doesn't know. But if I would say that, they would ask, like, oh, you're new here. What's your name? And I would say, oh, I'm Delaney. And, Dr. Turnpaugh's my uncle. And they'd be like, he changed my life. He saved my life. Like, just impromptu testimonials. No, didn't ask for it. They just had to tell me about how, this practice and these people here have saved their lives, not changed their life, saved their life. So.
And so, thanks, Delaney. It just goes to show, here's my niece, whom I love dearly. We're a very close, loving family.
And she doesn't even know.
Well, but because it's not, because here again, it's the work. Like, I don't go out and say, look at what I did today.
Yeah,
and
you're busy doing it.
Yeah, right. So, and I would always say, even though, you're doing amazing, extraordinary things in the IV room and changing trajectories in people's lives, we walk out saying it's just our job. So, we take it, but it's what we're supposed to do.
Yeah.
We're doing what we're supposed to do.
And so here I am a year and a half later, and it continues. Like, my worst day here, I don't even know what that looks like.
Dealing with me?
Yeah. No, there's never, the environment as far as an employee is concerned, it's just a completely different place to work than any other place that I've experienced. And then there's the people, and so I see people, and I have the unique opportunity to sit with them for usually about 45 minutes, sometimes longer, depending on the infusion that they're receiving. And I, like you were saying, I not only believe in what I do because there's research that supports it. I believe in what I do because I see people return to wellness, and I see people, the course of their illness is changed, and it's not always linear. And I think one of the adjustments that I most recognize that people make in this form of medicine is that we're not just throwing things at people, because I feel like sometimes when you go to see a doctor, they expect them to have some kind of intervention. So here's antibiotics for this ear infection that would have resolved anyway, just because I don't want you to come here and feel like you've got nothing.
Right.
Here, it's like the in-breath, the pause. We're going to not do something just for the act of doing something. We're going to do something because the intervention is meaningful and necessary, and serves a purpose in your return to wellness.
And it's not always the right one.
It's not always the right one.
One of the phrases that I have learned to express to patients is, I might make a mistake. In fact, there's a high probability I'll make a mistake on the case. So you're complicated. You're coming from greater than 2 hours away. You've seen 11 other physicians who are all brilliant, or they wouldn't be physicians. And you haven't had success. So while it's my intent to find a different path, there's a high probability along that way I'm going to trip. And you've seen it, and probably at my direction, hey, do this. And you're like, well, that wasn't the right thing to do. But the openness to say, we're here to get you better, and we're going to love you through it, but it doesn't always go linear.
Right. And that's
but with a resolution.
That's another unique opportunity I have in the IV room, is that I then see people also interact with each other, and they usually, after a few times, or maybe the first time, because we're all together there, they share their story, and there's an understanding of that and an appreciation of it, and a willingness to, it takes a little more to be part of this practice because of the way we structure things, and because insurance isn't always necessarily covering things that we do. But we see people return to wellness, and we see people willing to tend to their health as the priority. And then I get to sit there and listen to somebody who spent 10 years getting nowhere till, again, the end result is somebody saying, since I can't figure this out, it's in your head. And then they come here, and 2 months into treatment, some IVs later, they're able to do things that they forgot that they could even do. Have energy, think. It's like basic. Get out of bed in the morning, feel alive, and it's just it's a gift, and it's a gift for them to be able to share with each other that experience. And
interesting point. So many people are told it's in your head, and so often that should be relayed as, I don't know what I'm doing anymore.
right,
Like I'm on, and I say on this side of the desk as the physician, if I don't know what to do, it's clinical incompetence, but I can't portray that to you because I have a bunch of letters behind my name, so therefore you're crazy.
right,
Not to say there aren't some craziness out there. I'm not negating true mental illness. That's not
right.
what I'm saying. But I think it's an overused diagnosis when the diagnosis should be labeled as incompetence by the physician.
Yeah, or and there's room to say, again, like we do here, if it goes beyond what I feel I can provide or my understanding, let's reach out to somebody.
Right.
There's no ego involved. I'm not going to place it back on you as being solely responsible to understand things that I went to school for 11 years to understand. And I think that's another dynamic that our patient population really appreciates is radical honesty. I don't know, but I will do everything I can to find out.
Powerful statement, right? From a healthcare provider is, I'm going to make a mistake, or I don't always have the answers. And the openness to say that. And it's okay to say, I don't have the answers, but I'm going to work to try and find them, or I'll try and find somebody that can. Or we have a team of 11 providers that, through their collective experience, has, hundreds of hours of, hundreds of years of clinical experience to fall back on. Yeah. It's your expression of that is perfect. It's right on.
Well, it's a gift
Yeah.
that you give to everybody here. Being radically honest.
Thanks, but I don't know. So,
and it's also a testament to trust.
Yeah.
And that's why that initial relationship, the foundation, is so important because, and where I feel, again, even with my own relationship with my provider prior to coming here, because now, of course, I only want to see you guys. I didn't feel that connection or that foundation of trust. And so if he were to say to me, I don't know, my response might have been different because we hadn't taken that time. He hadn't proven to me that he was truly invested in my care or my return to wellness. I felt that I was just another part of his 15 minutes in his day.
So that's interesting too, because for so long I had to be an island because I didn't have other providers with me. And quickly you could find in the community of providers those that were open and those that were closed-minded. And I was talking last night, actually, we had a patient, extremely complicated patient, one of the most complicated patients. Johns Hopkins, she was complicated there, and the doctor who was treating her there, who left to go to Stanford, continues to follow up with her because it's one of the most unique cases he's ever seen. And so she was here, and we were working with Hopkins, but her family doc was like, oh, that's crazy. Those people over there are crazy. And just a quick shout out. So I said, I think you would do better with a primary care provider who was willing to listen to your story because you've had some success here. Your doctor at Johns Hopkins is saying, whatever you do, stay in that office because of the success. So I said, why don't you go see a different doctor? We sent her to Dr. Ghosh, who's a local primary care provider, who's in institutional medicine, and he doesn't endorse us, and he doesn't negate us. He receives it with an open mind, and he's a provider who is saying, I'll listen to what they have to say. I'll take it under critical advisement. I'll listen if it resonates with me, okay. And he's also saying, I'm not sure some of the stuff they're doing, but we're keeping an eye on it. And that's all we ask for, is that openness.
Yeah.
That open mind.
Yeah, that's so.
So if your provider's like, nope, that's crazy. Like, well, you know what's crazy? Being sick for 10 years. That's crazy.
I had that exact same conversation when somebody had to go to the emergency room, and the ER physician took the time to come over and tell this person that chronic Lyme doesn't exist, and that they were a perfectly healthy 20-something-year-old. And I just said, let's take a moment to reflect upon you in the ER with 3 major infections. Right. First of all, why is this person wasting that moment on saying something that isn't even relevant to why you're there? You're not there for Lyme treatment. You're there for treatment of pneumonia and mono and strep.
Right.
Second of all, if that ER doctor is telling you you're perfectly healthy, please don't ever let him provide care to you, because he obviously missed something in nurse or in his medical training, that he does not recognize the fact that you sitting there at your age in the ER with 3 major infections says something about your immune system. And
yet he's using his energy to bash and shame.
Yeah, and that's
There's
crazy.
nothing wrong with you. Well, clearly, even if this is one of the cases where it is psychological, clearly there's something wrong with me, because I showed up in the emergency room when I'm 27 years old. So yeah. I think something's wrong with me. So either something's wrong with me or something's wrong with my mind.
Well, and
there's nothing wrong with you. Well, that was helpful.
Quantifiable. I mean, tests were run, and yes, she does have all.
And again, that's your opportunity to interface with a human being, and you chose to say, "You're crazy. Nothing's wrong with you."
Right.
What a disservice to humanity.
Well, and that's when I try to be respectful and not use factory medicine or institutional medicine. And it's not an individual. Each person I would assess individually, but as a whole, and just what I know is required of an institution as mandated by the powers that be, there is not room. Even in the educational process, it's very much dictated by things other than a person's conscience or desire to do well.
And again, there's a time and a place.
Others.
Yesterday we had a young girl come in, and her finger was basically cut off and hanging there. And she came here, and I'm like, yeah, that's not for us. We sent her over to the emergency room, and she had to have stitches, and she had a bone fracture, an open bone wound healing. And she needed, emergent care, and that was right for her. But that's not right but she can still be treated with compassion and respect and humanism.
Yes, always.
So then you start working here, and you're starting to do IVs, and your background was all IVs, right? So you've done thousands of IVs before you came here?
Oops, Heather hired me based on my sense of humor. No. And then I said to her, ironically enough, in the hospital that I worked in, we actually had an IV team.
Which means?
We never did IVs.
You never did IVs.
So I had a little bit of a learning curve there.
Which you've conquered amazingly.
But yes, and we have a very challenging patient population as far as their vascular status goes.
Very dehydrated, very chronically sick. So
also,
typically these are the people in the hospital that get the IV team, and you have just become the IV team.
Right, with their little machines so they can find the veins. And as we're training another nurse to go to Mannheim and be their full-time IV nurse there. One of the things that I said to her, she has the skill. She's been in the ER for 7 years. She's started her own IVs, and she's does that perfectly. And I said that it's so important that this is the piece of information I feel I can give you, is that most of our patients come here after years of being stuck needlessly multiple times. People were unable to stick them, tests that resulted in nothing. You have to pay attention to that, and you have to take a moment before you start everybody's IV and just respect them.
Just honor them.
Yeah, and just honor it. And so I do it with a little bit of nice deep breath, just a moment of peace and respect for what they've come through to be here. And we have different patients who have severe needle phobia because of the situations, almost, I would use the word sometimes, trauma.
Almost like asking you to get into a car.
Right,
like,
right.
Go ahead and get in the car. Like,
I don't understand. It's just a little needle.
It's just a needle. It won't hurt. Like, you know what? Yeah.
And so I think that I feel very strongly that we always take a moment to respect a person's journey and respect their emotional response to what we're doing. Regardless, it never becomes repetitive action for me. It's always that individual sitting in front of me. And the good news is that I've built this foundation of trust. So on days where somebody shows up dehydrated and I have to stick them more than once, they're okay with that.
It's like running late, right? Like, you get it because I get it.
Here we are. I care about you. You didn't drink because you weren't feeling well. And now it's probably going to take me another try, but...
and another option to say, you should have, should have drank. You're like, that's just shame. Like, if I could have drank more, I would have.
Right.
So I get it. So understanding the human condition.
Yeah.
So I want to talk a little bit, too. So that brings you kind of current, right? So you're the IV
here
nurse. You're here. You're the IV nurse. But I think in your previous job, you were kind of limited as to even allowing the thoughts to get to where you wanted to go. So I know you had a desire to be a midwife, but you're kind of stuck in the mud. So we hopefully, one of the other caveats of this office is we think outside the box, and we continue to encourage others to think outside the box. You kind of brought up that patients come, and they educate us all the time. And then it allowed your mind to kind of expand to possibilities and thinking of different ways. And I know you have earned and encountered and experienced, I don't want to say earned, but experienced a different nursing degree that I knew nothing about. I love, but I know nothing about it. And I would tell the audience what it is, except I will screw up the name.
So I'm working slowly but surely towards my certificate in anthroposophical nursing.
Yes, that word. Which, tell me what that is.
So...
or you've told me, but tell the audience what that is.
In thinking about it again today, because it's so much, and I was trying to put it in a nice little tidy box. It's basically integrative healthcare, integrative approach to caring for a human being before that word existed. So it's looking at a person in the sense of their wholeness and the way that engages with the environment that they live in, the other people that they are surrounded by, and then pulling in different modalities of treatment, including from plants, minerals, changing the environment. It's based off of the teachings of Rudolf Steiner, who is an obscure German philosopher who actually is responsible for starting Waldorf schools, which my daughter attends, and which is where
is that where you heard about it?
Yes, where I first learned about anthroposophy.
Which I can't say that word still.
Yes, yeah. So people always think about
anthropology,
which it is not. And it just really resonated with me in treating a person's wholeness, their state of being spiritually, emotionally, mentally, physically. And so it fits nicely in with what we do here. Yeah. And it feels the most right. There's some things that probably would seem a little non-traditional to people.
It's everybody's in a box, but if your box has very shallow, small walls so you can jump out of them easily, that's kind of what we have. Everybody has to have a starting point. So
right.
Protocol to me is like a 4-letter word, but you have to have a starting point.
Yes.
But as long as your starting point isn't confined and defined by your structure, and it has that latitude. And that's what resonated with me. And I know I'm a big supporter of it, even though I don't fully understand it, which is great, by the way. I love to have people on our team that do things that I love that I don't have any idea about. Like I like that. I don't need to be the end all be all, and I love that you bring that to the table. So I can send a patient to you and say, she will fill a void that I'm incapable of filling. I can't. I would love to be all things to all people, as I think everybody would, but the recognition that I can't do that, but I know Tara can, and she fills that void. What a gift to our patients and to our office. So I'm just grateful that you do that, and I fully don't understand it other than to say you do.
Well, working it's a process of understanding, and
as life is a process.
Yes, yeah. And interestingly enough, so I actually, in order to go to the course, I put a GoFundMe up because it was a little beyond my financial capabilities. And we had many people who come here support me financially and continue to ask me about how I'm doing in my studies, and a few people even who have taken on their own exploration of anthroposophical nursing, anthroposophy, biodynamic farming, which is all tied in, and resonates even with people who you wouldn't normally expect to perhaps be open to something like that.
Sometimes we limit other people's potential for experience because we're afraid to share.
Right, yeah. Right. And I think
I suffer from that.
Yeah. And so the beautiful aspect of this practice, one of the many, is that we see people from so many different walks of life. And
we see the high-powered execs who fly in their private jets,
right,
to the people who are, we had a patient who saved up her money to take a cab here one day.
Yes.
She saved up for 9 months for cab fare money just to come here, which, of course, at that point we waived her fees. We took her on as gratis. But the people from all walks of life, and we don't judge them, but we have the wealthy and the poor, and we have the arrogant and the humble, and we have the people who don't understand what's going on and have no desire to the people that take on anthroposophy as a way of life.
Well, so what I've learned, what I always knew, but what I am able to see in action here is that wellness and the desire to be well and the journey to wellness, it really creates a universal language and understanding amongst people that you might not ordinarily expect to relate to each other
without discrimination
in a room. Yes. Yeah. So yes,
based on financial or sex or age or race, right, or religion.
And it's actually a beautiful in all the struggles and how I see that people have had to renegotiate their lives to meet their illness and to adjust around it. It is a leveling, a humbling that's actually really an honor to witness, as I see these two people that outside of this experience probably would not
never have talked.
They might even be angry towards each
right.
other.
Yeah.
And
they're
here they are,
right.
and now they are able to take that connection and take it out. So they're a little more open. They're feeling a little better, and they're maybe understanding that their ability to relate to somebody doesn't hinge on that person being exactly like them, because in illness we are no different from the next
right.
person.
It doesn't matter if you're black or white or yellow or green or
right.
purple. If you're sick, you're sick, and the reason for the illness, many times, not all the time, but many times, is independent of
all of those things.
Your parents, your social status, your race. I mean, there's some issues where race plays a role, but by and large, it's, bugs don't discriminate, and they're not all bugs that are the vectors of issues here, but and then just kind of putting it all together. I mean, it's a wonderful journey. What else would you like to add?
Just that every day I enjoy coming to work, and I think that's what you're supposed to do, to not feel like you're working, and the gift of knowledge that I'm surrounded by. It's just a wonderful thing to be able to connect with my coworkers, to work alongside of these people that know so much about so many different things. I work across the hall from Patty, the LDA nurse, and Andrew is there, also the acupuncturist. And I mean, speaking not of myself, but of the other practitioners, you really have picked the top-notch as far as knowledge is concerned, but also as far as their ability to understand how we do things differently here and connect with people in a way that honors that and serves them in a way that's consistent with our approach to engagement. And I just love it. I love the people I meet here. I love the patients that I'm able to take care of. I love the fact that you make yourself accessible. So if I have a question or concern, I can come to you and say, I don't have a good feeling about this, and you don't ever discount it. In fact, oftentimes you pop into the IV room, which if you start to do IVs, I feel like you might put me out of a job because I'm only wanting to schedule with you.
It's when you bring that up, there's a phrase that I would love to probably inappropriately squeeze into this podcast because I try to say it to myself every day. I heard it at a seminar a long time ago. It's from Mark Twain, I think it says. And he says, it's not what you don't know. It's what you know for certain that just ain't so. And it sticks with me. So when you say, this is going on, if I say, nope, that's not what's going on because I know that can't go on, then it's not what I don't know. It's what I know is true, but it's not true. I know, and so it's not what you don't know. It's what you know for certain that just ain't so. And so coming in with that mindset, when you say, hey, this is going on, some guy's turning, orange and pink and purple from drinking a glass of water, I'm like, oh, that's not true. And maybe it is. So being open-minded to that. And so I love when you bring me that thing that I thought I knew what I was talking about, and I'm humbled by the universe saying, that ain't what's going on. So
Yes. Yeah.
So I don't know if that was appropriate to squeeze that quote in, but I love that quote. And when you live by that, then you just got to say, just because I knew it was true, maybe it's not. Maybe it's not. Maybe and if we approach healthcare like this can't happen, but it did, or
Right.
This is what's going on, unless it's not. When I teach, I say sometimes, this will work, unless it doesn't.
Right. Yes.
And then what do you do? And then if it doesn't work, well, you're crazy. You must be crazy because what I knew for certain to be the case, this is how you get out of that hole. Well, I did that. I'm still in the hole. Then you're crazy. So kind of taking our education and our knowledge and throwing it on its ear and being open to maybe there's a different way.
Well, there is a different way, and it happens here. And I think the best part is seeing people have knowledge, but the wisdom is being able to utilize it on a person who's ever changing. There's not a fixed point in any one person that we take care of here.
Yeah.
It's always...
It's a moving target.
Yeah, yes. And
so, yeah, I mean, it's now I'll speak now. It's truly a gift and a blessing that you're at our office. I mean, it's just, you bring such happiness and joy. You're like a little light bulb that comes in all the time. And
with my sparkles.
Yeah, positive attitude. And it's so important. It's not tangible, but it is an intangible. It's not something I can measure, but it's something that is required for healthcare. I'm so blessed that you're here. And I don't think it's a coincidence. I'm just one of those people. I don't think these are coincidences. And, you can teach anybody to stick somebody with a needle and infuse in them whatever we choose to infuse and put an IV in them. But you can't teach heart. You can share it and you can hope other people catch it by being contagious, which you have in spades. But I think what you bring to the table is a level of healing that can't be appreciated. It's not a blood test. it's a level of compassion and caring, which means going the extra mile too. And so, if nobody has had the pleasure or experience or need to meet you in this office, I would encourage them to do so. It's just I mean, even in the lunchroom, if you're not here, there's just a level of energy that's not here. There's just a level of happiness. There's a level of joy that's not here when you are here. And not that other employees and practitioners and our staff doesn't carry it, but you add to it every time you're here. You never suck the wind out of the room or the air out of the balloon.
Oh, well, that's
It's true. It's just, it
makes my little heart smile.
It's it's just awesome. I mean, I work late many times, like with you, and it's just, if I'm tired or grumpy because I've been here for 13 hours and I got a 2-minute lunch, and you're here, it just changes your trajectory. So I can't imagine what that's doing for patients. Actually, I can, because I get the benefit of seeing the patients after they've been with you for several times. And sometimes it's the intangible. They've done the same type of things at other places, but not gotten the results they've gotten when they're with you. So it's just an honor and a blessing. And I'm actually grateful that you're our first go around with the podcast, because I love sitting and talking.
You.
Yeah, great. So, I mean, for those who have invested the time into listening to the whatever time we spent together, if you don't know Tara, please get to know her. Please stop by. Please say hello. It's really, if you don't, you're robbing yourself of some happiness and joy and filling your cup that you won't get anywhere else. So.
Well, thank you. It was a pleasure to be the first unofficial podcast.